Coughs are a common concern, especially during early childhood. A cough is a reflex action that helps clear the airways in the throat and chest. It's the body's natural way of protecting the lungs and air passages. Coughs can have many different causes, and although they may sound quite concerning, coughing is usually not a symptom of anything dangerous. What are some common types of coughs? There are several types of coughs you might encounter in your child. Barking cough. This cough is often a result of croup, a viral infection that causes swelling in the airways. Croup can occur suddenly, often in the middle of the night, and leads to a cough that sounds like a seal barking. Most cases of croup can be handled at home, but it's worth a call to your child's healthcare provider to determine if they need to be seen. Whooping cough. Also known as pertussis, this highly contagious bacterial infection causes severe coughing spells, followed by a whooping sound when the child inhales. In infants and very young children, pertussis can be deadly, so call your child's healthcare provider right away. Cough with wheezing. Wheezing is a high-pitched whistling sound that can accompany a cough. This often means the child's airway has narrowed due to swelling or asthma. Sometimes, wheezing is a sign that an object may be blocking the lower airway. Call your child's healthcare provider if you hear wheezing. Stridor. Stridor is a harsh, vibrating noise that happens when a child breathes in. Most often, stridor is a sign of croup, but sometimes it can mean there's a more severe infection called epiglottitis, or there's something stuck in your child's airway. If your child has stridor, call their healthcare provider right away. Nighttime cough. Lots of coughs get worse at night because when a child lies in bed, the congestion in their nose drains down the throat and causes irritation. Nighttime cough can sometimes be a sign of asthma and should be reported to your child's provider. Daytime cough. Persistent coughs during the day might be a sign of allergies, asthma, or a cold. Most colds come with a cough, which is often the last symptom to clear up. Cough in infants. Keep a close eye on a coughing child who is younger than 6 months old. This group is most at risk for complications from respiratory syncytial virus, or RSV, a common winter cold virus. In very young children, RSV can lead to a more serious illness like pneumonia. In some cases, a child with RSV may need to be hospitalized so they can be given oxygen and fluids. When should I call my child's healthcare provider? Most coughs are nothing to worry about, but you should call your child's healthcare provider if your child has trouble breathing or is working hard to breathe, their lips, face, or tongue have a bluish tint, your child is less than 3 months old and has been coughing for more than a few hours, they have a high fever or a fever that lasts more than a few days, your child makes a whooping sound when they breathe in after coughing, your child coughs up blood, unless they've just had a nosebleed, which would explain it. They have stridor or a wheezing, or your child seems unusually listless or out of sorts. How can I treat my child's cough at home? While some coughs may require medical attention, others can be managed at home. Here are a few tips to help soothe your child's cough. Use a cool mist humidifier in their room to keep the air moist. For older children, you may prop your child's head up with pillows while they sleep to reduce nighttime coughing. However, do not elevate the bed for infants. If your child wakes up with a barking cough in the middle of the night, take them into the bathroom, close the door, and let the shower run on hot for a few minutes. Once the room steams up, sit in the bathroom with your child for about 20 minutes. The steam should help your child breathe more easily. Don't use over-the-counter cough suppressants without specific instructions from your child's healthcare provider. Coughing is the body's natural way of clearing mucus and congestion from airways. Sometimes stopping a cough can do more harm than good. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information, please speak with your primary care provider or visit bostonchildrens.org.